Showing this and every Wednesday at 4 p.m. on Vibetown Media.
Good evening, viewers. Welcome once again to your number one health show, Health Zone, on Vibetown Media. This evening, we are talking about meningitis. We have in the house Mrs. Lawrencia Kwakye Ansong, who is a neuro nurse specialist who works at the Korle-Bu Teaching Hospital. She is the first trained neuro nurse specialist for the hair department in Korle-Bu, and also the only nurse trained in neurology in Ghana. Welcome to the program, Madam Lawrencia.
Thank you, Madam.
We are glad to have you here. Okay, so we want to talk about meningitis. We want you to tell us all we need to know, at our level with meningitis, and what we can do, what we shouldn't do, how we can live on with or without meningitis, and everything that has got to do with meningitis. So without much ado, tell us please, what exactly is meningitis?
Thank you so much, and I'm so pleased to be on air today talking about meningitis. Basically, meningitis is inflammation of the covering of the brain and spinal cord. So when we talk about meningitis, basically talks about the lining of the brain and the spinal cord. So meningitis comes in when there is inflammation or swelling of the brain, the covering of the brain and the spinal cord.
Okay, so when it comes to this condition, who can be infected? Which people are predisposed to getting this condition?
Meningitis affects all manner of people, irrespective of age. It can even affect people less than 5 years and above, irrespective of sex as well, whether male, female, you can get infected with meningitis.
Are there specific causes?
Causes of meningitis, we have two causes. Basically, we have the viral cause and we have the bacterial cause.
Okay.
So based on our lab investigations, it may prove that it's caused by a virus or it's caused by a bacteria.
Oh, okay, that's fine. So when one gets meningitis, even before the labs and everything comes in, are there any signs and symptoms the person exhibits that would draw our minds towards that condition?
Sure, there are signs and symptoms that will make us suspect before the labs are even done. First of all, because it's an inflammation, because it is an inflammation, you're going to get an increase in temperature. That shows that there is an infective process in the body. So you feel hot and the temperature will go above normal. Then there can be headaches. There can also be vomiting. And then the person will also get neck pain. The person is unable to turn the neck freely as any normal, in quotes, individual does. And then the person will also have what we call photophobia, inability to stand light. So these people would want to be in a darkened place where the light source is minimal. With time, there can be seizures that we may mistakenly take it to be epilepsy, but no, this is due to the inflammation of the meninges.
Okay, so with the mention of seizures, it takes my mind to a certain myth. So on Health Zone, we try to dispel some of the myths out there. So when you mentioned seizures, it took my mind back to something. People say out there, there is word out there, that if you suffer a seizure, it means there are witches after you, or you've been bewitched. Some say a throw account, some maybe a throw, some say The owl, I hear low from. That's what the dance call it, but I don't know. Yes, the owl. I don't know the name in other languages, but I hope you know what I.
Sure,
So they say that's what causes it and all that. What have you got to say concerning this particular myth out there?
I'm happy you talked about the fact that it is myth.
Yes.
Myths are not real.
Yeah.
So seizures has got nothing to do with spirituality. Has got nothing to do with evil spirits. So leave seizures alone. Basically, seizures come in when there is an infection. For instance, you can have seizures when you have meningitis, just has been rightly spelled out. And then you can also have seizures when there's an increase in the temperatures, especially for children. When the temperatures increase above normal, they can have convulsions. Those are seizures. And if care is given and temperatures normalize, these babies will live a normal life. This one, there's no need sending these people to any.
Yeah, they take them to spiritual homes, their churches, for treatment. So that's why it's very important we talk about these things.
You will kill these people when you send them there, because over there, infection rate is going to even increase, because for them, what have they got to do? And the temperatures also, it deals with the brain, the hypothalamus. So it increases and increases, and if care is not taken, you may lose that person, and that person may even be a breadwinner. So should you lose this person to seizures,
the $1 million person,
everything is gone. So please, immediately you see these kind of seizures, rush the person to hospital. But first of all, in another meeting, we'll talk about how to manage these people home.
Okay.
That's sort of first aid before they are sent to the hospital.
Okay, so that will be a different session altogether.
Exactly.
Yeah, that's fine. So there's another myth. I don't want to call that myth, but it's more of something people have put in their mind that they say often with a lot of conditions. They say in your hospital area, it's not a disease for the hospital. And meningitis is one, because it presents with seizures and some strange stuff that people don't really understand. So the moment they see the seizure, they are like, oh, this one is not a matter for the hospital, like you said. Okay. So I want you to tell them, is meningitis treatable?
Hello, viewers. Meningitis is indeed treatable. So do not, and I stress on the fact that do not take it for granted, because this one involves the brain. The person may get confused, and because the person is confused, mentioning words that are ununderstandable, we may mistakenly say it is spiritual. There is nothing spiritual about meningitis. Immediately you see your relation behaving in that way, having seizures or what may be termed as convulsions, unable to withstand light, and then with those stiff necks tells you, I'm unable to turn my neck, I have pain in the neck, all those things. When you see these things, don't take it for granted. Kindly seek medical advice. Thank you.
Can you kindly give us an overview, like a short overview of the kind of managements given to such people?
You've brought it back. Good. Okay. So when we talk about home management, briefly.
Yeah, I said briefly because we will talk about it fully in another episode. But just touch on it briefly for us.
Exactly. So when a person gets these convulsions, first of all, you need to make sure the environment is safe. Environment is safe in that this person may mistakenly hit the head against any available object. So you make sure that the environment is free from shafts, everything that may
might
injure
cause
the
harm.
person is out from the environment. If the person is also lying in bed, you make sure that the person doesn't fall. If there is someone to help the person on a flat surface, you do that. You make sure that you avoid choking by loosening all tight clothing, including belts, tie, if any, anything at all that the person has around the neck, around the waist, so that the person will freely go through. For sometimes the seizures, the convulsion episodes will come, and then some of them are self-aborted. Others would have to have medications given to them before aborting. And then you also make sure that you pad a wooden spatula, not a spoon. Again, not a spoon. Some people use this metal spoon into the person's mouth with an intention of avoiding the person biting the tongue. And if care is not taken, you may break all the teeth. Trying to do good, you end up doing harm to the person. So if you don't have a spatula home and you have that stainless spoon, you just need to wrap it with a cloth. Of course, the cloth should be clean. And then you put it at the side of the teeth so that it will keep the airway patent and then avoid the patient from biting the tongue. You make sure you protect the head from hitting other surfaces that can cause bleed internally or externally after the seizures. And then you quickly arrange for either an ambulance or any form of transportation so that the person will now continue in the hospital.
Okay, if you just joined us, we've been discussing meningitis, and with us is Mrs. Lawrencia Kwakye Ansong, Neuro nurse specialist, Korle-Bu Teaching Hospital in Accra. We are about wrapping up. It's been a wonderful discussion, very educative, very informative. Okay, so we are going back to finish with what we just started. Complications, since we are wrapping up, can you tell us some of the complications that might arise out of this condition, especially if it doesn't get the right care that it needs?
If it doesn't get the right care, can lead to so many complications. Some of them are hearing loss. Remember, this one has got to do with the nerves.
Yeah.
So you may have hearing loss, and then you may have epilepsy coming into stay because these are convulsions. Yeah. And then death is the extreme that may happen.
Okay. So viewers, there we have it. All we could ever want to know about meningitis and the complications. The complications are just like the adage that goes that the memory of the dead is a warning to the living. Anytime you listen to the complications that will come out of these conditions, it will take you back to the early stages so that you know what to do and what not to do when these conditions cropped up. We've been discussing meningitis with Mrs. Lawrencia Kwakye Ansong. Thank you so much for joining us. We hope to see you another time because we have another set of discussions. Thank you very much, viewers, for joining us. See you same time next week on Health Zone by Vibe Town Media. Shout out to my producer and director, Ahmed Said, aka Dr. Vibe. See you next week. Bye-bye.
Showing this and every Wednesday at 4 p.m. on Vibe Town Media.